I will not start again. So it's a great pleasure again to be here. And this session is co-hosted by WHO, and I would like to thank very much Dr. Santino Severoni for this very nice collaboration, and by the WHS Academic Alliance, which has been known until actually this year as M8 Alliance. You might know the previous name, because we organized several sessions in the past, here in Berlin, but also at the regional meetings on this important topic of migration and health, which of course, as we know, is quite neglected now in many countries, especially in Europe for political reasons, and this is very sad, and we are trying actually to keep the attention on this important topic. Today we have a panel of very distinguished colleagues, and first of all we have Santino Severoni, who is the Director of Health and Migration Department at the WHO in Geneva. We have Jaber Ufkir, is a medical student, liaison officer for public health issues at the International Federation of Medical Student Associations. We have Honorable Amira Saber, member of the parliament in Egypt. Lukoye Atwoli, professor and dean of the Medical College in East Africa at the Aga Khan University in Nairobi in Kenya. Marionka Paul, professor and global head head of health policy and advocacy of Save the Children International. Petra Kuri, Director of Health and Care Department of the International Federation of Red Cross and Red Crescent Societies in Geneva. And Stephen Matlin, a visiting professor at the Institute of Global Health Innovation of Imperial College London. So without further ado, I would like to leave the floor to Dr. Santino Severoni, who will give us a keynote on this important topic. Thank you.
Good morning, everybody, and thank you, Luciano, for your kind introduction and collaboration. But before to start, I'd like to get this opportunity to thank you personally for your leadership, for keeping health and migration topic always alive into the World Health Summit. This is becoming a traditional gathering every year, so thank you very much for your commitment and support. Today, I didn't prepare any formal presentation, just few thoughts to stimulate a bit discussion and to frame the situation. Of course, it's an honor to be with you today to introduce a topic which is not just timely, but also crucial for the future of global health. The health of people displaced or migrating for different causes, including the climate changes causes. I like always to start with numbers, so it is crucial to recognize that displacement and migration is reaching unprecedented toll. Today, an estimate of 1 billion people globally are migrants or refugees or forcibly displaced population from their homes. Many are facing or may face significant health risks during their journey, while living in precarious, overcrowded conditions with limited access to health care. We show in the World Health Report in 2022 how this condition and the challenge faced during the migratory process are key determinants of health for those populations. So migration and displacement is impacting quite strongly on the health status and the outcomes of this population. Those individuals are driven by conflict, economic hardship, and increasingly by environmental pressure. Drivers of displacement are complex, and climate change acts as a multiplier by amplifying existing vulnerabilities such as food and water insecurity and damaging of homes and livelihoods. Many are even displaced multiple times. That's what we are observing. As we move forward, a projection of displacement are on the rise, and again, estimates of people moving because of climate change causes are quite impressive. Estimates are that 3.6 billion people are living in areas which are climate change vulnerable, and an estimate of, or a projection of up to 1.2 billion people might be displaced by 2050. Migrants and displaced population are keeping facing unique challenges, including as I say, recurrent displacement, legal uncertainties, and cultural losses, all impacting the health and vulnerability of these people. What is often overlooked in the discussion of migration is the health dimension. Climate-induced migration poses profound health challenges. The direct impact, such as injury or death during extreme weather events, are often the most visible, while the more indirect impact, including wider economic changes, which will both affect health and drive migration and or displacement. Let me give you some examples from around the world. The prolonged drought in Somalia and Ethiopia have been causing extreme food and water shortage and loss of income due to agricultural changes, leading to displacement and migration and concerning condition of malnutrition for the population interested. The refugees Rohingya hosted in Cox's Bazar have been several times exposed to increased risk of vector-borne diseases or infectious diseases because of the cyclones and flood-prone condition in that area. And this has been requiring a coordinated emergency response, efforts during cyclones, but also the need to meet the health needs and prevent outbreaks due to infectious diseases or waterborne diseases, with a strong collaboration among sectors, not only health. Mental health. Mental health, it's very important to be highlighted, and unfortunately is a prevalent issue, with displaced individuals facing increased rates of anxiety, depression, and post-traumatic stress disorder. Rising sea level and extreme weather endanger the Pacific islands like Tuvalu and Kiribati, putting entire community at risk of permanent displacement. The psychological and emotional toll is worsened by the loss of culture and heritage, especially for communities like those from small islands who are not only losing their homes, but also their way of life. Those indirect impact will affect population not only now, but also into the future generation. We advocate for migrant-sensitive health system in all settings. We must prioritize strengthening of healthcare systems to be inclusive and sensitive to the unique need of migrants, ensuring the healthcare is accessible to all. A migrant-sensitive health system not only serves the displaced population, but strengthens the healthcare system of the host countries and ultimately benefit the entire population. But unfortunately, evidence to inform those approaches are still missing. And to address this, we have an upcoming evidence review of the best approaches to strengthen health system to better meet the needs of displaced population and migrants in the context of climate change that we're going to publish by the end of the year in the context of COP29. Much of the focus globally has been put on short-term humanitarian response, but we must also focus on long-term health system strengthening. We need to build health systems that are flexible, responsive, resilient, and sustainable, ensuring that they can continue to support both displaced population and host community over time, regardless of the migratory status. That's very important to be underlined. Addressing the health impact of displacement requires investment in health infrastructures and workforce capacity. We thought important from our side to contribute to this challenge by launching a series of country health system reviews and training on competency standards for healthcare workers, really to impact into a critical mass of countries which they have better capacity and understanding and position in terms of shaping their own health system. Solution to those challenges must be grounded in policy. We need policies that ensure equitable access to healthcare for all, especially those displaced or migrating, including due to environmental factors, and also addresses the social determinants of health as well, emergency planning. We are conducting a global research prioritization, in fact, into this topic to identify key questions to inform evidence-based policy making. The idea is to encourage, assist countries to start to conduct country-based research and to use the evidence collected to inform the policy-making process and shaping up the health system. But we also need better disaggregated data to guide approach to meet the need of those populations. To this end, we are working with countries to track their progress in implementing the WHO Global Action Plan and promoting the health of refugees and migrants and improve understanding of health needs. This is the first global monitoring of policy setting and response of countries. We are planning to release the report at the next World Health Assembly in May. It is essential to remember that at the center of these issues are people, individuals who have left their homes, their communities, and their identities. They must be included in the conversation around their health and well-being, but it's not enough to design policy for them. We must design policy with them, ensuring that their voice and perspective are central to the decision-making process. In conclusion, it is essential for policy makers, health practitioners, and advocates to recognize the health, migration, and climate changes are deeply interconnected. Addressing those challenges require collective action, interdisciplinarity, collaboration, and a commitment to ensuring that no one is left behind. We need a future in which health systems are resilient and inclusive for all population. Migration is safe, and the need of those displaced, also because of climate changes, which are often communities that have contributed the least to this crisis, are addressed with foresight and urgency. I thank you very much.
Thank you very much, Santino, very interesting. Now we continue with the panel. We will open the discussion at the end with a youth voice. So please, Jaber.
Okay, thank you so much. Good morning, everyone. Okay. Good morning, everyone. My voice is not working today. The moment I stepped foot in Berlin, I got sick, so...
That's not a good sign.
Yeah, exactly. So good morning, everyone, distinguished colleagues and friends and panelists. I'm very happy to be here representing the International Federation of Medical Students Association. We are representing more than 1.5 million medical students worldwide. That's a big number. From more than 130 countries all over the world from different regions. More importantly, I stand here representing youth, a generation that will inherit the consequences of the decisions we're going to make today, particularly when it comes to the nexus of climate change, health, and migration. As we all know, the climate crisis is not a distant threat. It's happening now, and its impacts are real. In fact, recent studies have shown that by 2050, more than 140 million people are going to be affected by climate displacements alone. That's a big number. As the climate crisis escalates, the cost of inaction is already beyond what we can afford. Something that we have learned, a great lesson that we have learned from the COVID-19 pandemic, is that prevention is way more cost-effective than dealing with crises as they come. When you deal with crises as they come, you pay more. The same applies to climate crisis. Building robust and climate-resilient health systems is essential, not only to respond to the impacts of climate change, but also the impacts from, the health impacts from occurring in the first place, and save lives. Climate preparedness, especially in health, saves lives, reduce long-term costs, and protects most vulnerable populations. But let's be clear. Youth are not just future leaders. We are problem solvers of the future, of the present, I mean. We are innovative, not to say that older generations are not innovative, but we are adaptable and eager to address this escalating crisis. Young people, particularly in vulnerable populations, are already crafting solutions. From developing sustainable campaigns and initiatives, building networks to support displaced communities, or advocating for systemic change in national and international levels. Our fresh perspectives, unburdened by outdated frameworks, are essential in solving this climate mobility crisis. It is clear the solutions we need today must come from diverse voices, especially those who will live through these changes in the future. Investing in youth leadership and integrating our insights into climate mobility policies isn't just a matter of inclusion, it's a matter of survival. Youth initiatives are already playing a pivotal role in preparing communities from the challenges ahead. Through community-based campaigns, we are raising awareness about the intersection of climate change, health, and migration, empowering communities to become more resilient. We work on educating people about sustainable practices, community preparedness, and health responses to climate events. At the International Federation of Medical Students Association, one of our very active programs is environment and health. This program have coordinated more than 130 local, national, and international initiatives with the impact of an individual reach of more than 13,000 people from local communities, affected communities, and displaced communities. We are proud to say that this program is very active and it's really impacting lives. The inclusion of youth voices in policymaking should never be an optional extra. It must be a necessity. Policies created without youth perspectives often fail to reflect the realities we face. We are advocating for our rightful seat at the table. Because decision made today directly affects our future, so it's a natural ask. When youth voices are included in policy-making processes, we bring our sense of urgency, innovative thinking, and original solutions. But to make this work, our involvement needs to be meaningful, not tokenistic. We fully recognize that none of these efforts will succeed in isolation. We need strong, transparent, intergenerational collaboration. Youth bring ideas, original ideas, but the older generation bring experience, which is very important in this field. When these two forces unite, we can develop effective strategies to address climate mobility and its impacts on the vulnerable communities. But fostering a respectful, collaborative environment, we can create solutions that are not only innovative, but they have real impact on those communities. In closing, I implore governments to prioritize climate migration policies that prevent forced migration. I urge governments to protect migrants' rights to health, dignity, and security, and to meaningfully involve youth, migrants, and refugees in shaping the policies that will affect their future. Happy to answer any questions later. Thank you.
Thank you, Jaber, very interesting. Now the floor goes to Amira Saber, please. She will give us some insights on legislative aspects.
Hi, good morning. It's a pleasure to be here among those very important speakers. I thank very much the WHS and Unite Network for bringing parliamentarians on the table, because many times actually the policymakers, especially parliamentarians, were not included in such dialogues. There is always a kind of a ring left open, which is extremely important to tackle and to see. So thank you for the opportunity to speak today. And when it comes to the nexus between climate change, health, and migration, it's a very complicated nexus with the layers of vulnerability increasing also due to conflict and due to the lack of security in many spots around the world. I'm coming from Egypt, so Egypt now is surrounded with many hot spots of conflict that definitely reflects on the situation of the health system inside, and also given the climate change and the vulnerability, it adds on layers. At the core, these three issues, climate change, health, and migration, are interlinked under the framework of human security, and this is how it should be seen. Addressing them requires tackling their root causes, connections, and cascading effects. Climate change in particular is a risk multiplier. It exacerbates environmental challenges, which in turn influence health outcomes and drive migration. Although the term climate migrant remains legally undefined, the World Bank estimates that climate change will create 216 million internally displaced persons by 2050. These numbers are not just numbers. It's numbers that we should think of, that the policymakers around the world should monitor and evaluate their input month after month and day after day. The UNFCCC took a step forward during COP21 in Paris, establishing a task force to address climate-related displacement. Yet the impact of climate change continues to aggravate health and migration issues, especially in the African context. Developing countries are experiencing new types and intensities of challenges that their health systems are ill-equipped to manage. Hundreds of millions could become climate-related migrants by mid-century. And especially, I'm talking about regions like South Asia, Sub-Saharan Africa, and Latin America. My country itself is facing layers and layers of vulnerability and of climate risk, given the drought, given the amount of rainfall that is decreasing, and given this also amount of immigrants which we are receiving from Sudan, which we're receiving from Gaza, which we're receiving recently even from Lebanon, which makes our own health systems very vulnerable. Given also the economic situation and how harsh and tough it is, these kind of vulnerabilities create fractions within societies. So the nexus is very clear, and the climate change is a problem that makes it even worse. Across Africa, we see migrants frequently reside in informal settlements or relief camps with limited health and sanitation facilities, further compounding their vulnerability to health complications and climate challenges. And for this too, I want to address the mental health and the psychology of the immigrants and of the people who suffer from the consequences of climate change. So mental health here and psychic health is extremely important too. Myself, I was pleased to submit a bill to the Egyptian Parliament on climate neutrality, which included a clear provisions for climate refugees, mandating a rights-based approach and an inclusive policy-making process. On a positive note, Egypt, both as a host country for many African migrants and as a nation vulnerable to climate change and health issues due to its economic situation, shortage of medical personnel, has been participating in the IOM's fostering health and protection of migrants in vulnerable situations. This project started 2015. In 2023 alone, this project trained hundreds of healthcare providers on creating inclusive health systems for migrants. This also underscores the extreme importance of South-South cooperation, something I have advocated for many times. In a recent article also that I wrote to Wilson Center, I addressed how the climate vulnerability is extremely articulating in the war in Gaza, and how the women are suffering complex and compound situations. The price of victory, that was the title of the article, the price of victory in Gaza were women, climate and peace. The debris that goes from the pumps even makes the infiltration of them in the air, having massive consequences on the Palestinian population, especially women and children. So based on this and based on my legislative interventions, which I advocate for, I really vote for a kind of policymakers coming together. It's extremely important to keep these dialogues on and to have the donors, the agencies, the international agencies, and the countries that are having the capacity to capacitate others and to do the role in keeping the human security and in keeping this nexus toward this having real solutions. This could happen through different interventions, capacitating the medical staff and lots of trainings that could go on through these kind of collaborations. We should also keep tuned to the technologies. AI could give us a lot of solutions on this. Telemedicine, for example, has solved lots of problems in my very own country, because the accessibility and the reachability of the services for those who are left behind is challenging, and technology could offer solutions for this. Also, besides the transfer of the different knowledge and experiences from one country to another, the policy frameworks should be much more coordinated. The international funding and the transfer of technology and of experiences. I haven't seen for a long time kind of memorandum of understanding or real collaborations between universities from the global north and the global south, or even between the universities themselves, which tackle such nexus. The topic we are talking today is touch basing with the lives of millions of people from all over the world. And it's not only a problem of one country which suffers such vulnerability. It will come to you. This is the thing. I think what COVID left us with is that there is no way that someone could be safe until we are all safe. And the same thing applies for climate too. So we really need to rethink this over and over. I think of the following steps as essential: a comprehensive review of developmental policy to ensure a holistic approach, recruitment, training, and retention of medical staff, given the multifaceted nature of this issue, investment in reproductive rights and trauma treatment, the use of proper facilities rather than camps for migrants. We don't do this. We don't do camps for refugees in Egypt. They are very much integrated within the community. The use of proper facilities rather than camps for migrants, moratorium on banning migration, fostering South-South cooperation, and guaranteed healthcare access for migrants. The slogan, "Leave no one behind," should be prioritized, and the time for action is now, but now is really now. Thank you.
Thank you very much. Thank you very much, Amira. Now we go to Lukoye. He will give us a concrete example also in Kenya in relationship to the conflict among the pastoralist communities. Thank you, Lukoye.
Thank you very much. And I'm just picking up from the Honorable Member of Parliament. I'll begin by saying that I think I would challenge every human to look at their own history, and that we are all, most of us are probably migrants. And I say this as an East African, and arguing that all of us came from East Africa. We all came from Kenya. And so the vast majority of us are migrants. And when we do policy, when we do systems, when we create structures, we have to think about how those structures would work for us as migrants. And I think health outcomes of both climate change and migration are key determinants of well-being. And I'll give you an example from my country. A recent example, 2008, we had some conflict after an election. There were very many people who were displaced within the country. And in the beginning, the interventions were based on thinking about host communities and the internally displaced. But towards the end, we had to think about strengthening systems and structures so that they can serve everyone in that locality, rather than thinking about some people being hosts and some people being displaced, in thinking historically about everyone being a product of migration. And so in my country, I think a significant proportion of the population are pastoralists, and their lifestyle involves migration, and a lot of this is influenced by climate change. And because of changes that are partly political, from colonialism, where we started structuring the land tenure system so that migration became difficult and people started owning pieces of land, these populations have had trouble moving as a result of changes that have been happening historically. And as a result of that, there's been increasing conflict in those regions, as several groups compete for the same pasture, the same water sources. And the result of this has been that people now go to capture animals from neighboring communities in order to sustain themselves. At the root of these conflicts, I think there's a lot of uncertainty about weather patterns and climatic conditions, traditional water sources, pasture grounds are drying up, and everything is getting shrunk. If you go into those communities now, we are finding a lot of nutritional deficiencies among the people and among the livestock. There's this fueling desperation, and it results in increasing conflict with young people having to get involved in raids for animals and grazing space. Some of the work we've done in those communities have shown that there is an increase in anxiety disorders, post-traumatic stress disorders, substance-related disorders, suicide, and depression. These have been documented as outcomes of this increasing conflict as a result of the restriction of movement that is necessitated by climate change. Our work has also shown that in those communities, the concept of climate anxiety is real. And people have been expressing their worry about the future in relation to the things that are happening in those communities today. And so ecological grief and anxiety are real in the communities in northern Kenya and along the coast where they're experiencing the effects of climate change. Looking forward, I think when we think about reducing conflict globally, I think we have to reset the mindset of policymakers and people to start thinking about everyone, first of all, as a migrant, and think about ourselves and think about setting up systems and structures that will take care of ourselves as migrants, and therefore not classifying groups of people as foreigners or people who are displaced coming in, but as people going through the natural cycle of life where you move from places that are uncomfortable and move to places that are comfortable. So in the context of Kenya, we think that addressing the impacts of climate change in those areas will reduce the need for migration, but also will help begin dealing with the mental health outcomes that create the vicious cycle that we are seeing. I think changes in our environment and changes in our climate changes our mind and how we think and how we do things. And this, in turn, forces us to start thinking about changing the environment in order for us to be more comfortable. And in changing the environment for us to be more comfortable, we make it worse and create a vicious cycle that makes us keep making those changes. So I think we have to keep the impacts on mental health at the forefront as we deal with the impacts of climate change in our communities. Thank you.
Thank you. Thank you very much, Lukoye. And now we go to another very important topic, how to protect children in this climate crisis. Marionka, please.
Good morning, everyone. I'm Marionka Pohl, and I'm representing Save the Children today in this workshop. Thank you very much for listening. And I would like to start with a remark. First of all, the climate crisis is not just an environmental crisis, it's really a child health crisis. And I would like to tell you a story that is really exemplifying that, the story of Rukia. Rukia is a mother of 10 living in a rural area in the Somali region of Ethiopia. She grows crops and she raises livestock to feed her family. And like many people in this region, she really depends on herding and small-scale agriculture to feed her family. But Ethiopia is one of the 18 countries, and Dr. Severoni mentioned that, that is faced by increased food insecurity due to climate-related disasters, really affecting livelihoods, destroying agriculture, crops, and food systems in general. And that is leading to Rukia to at times not being able to feed her children even one meal a day. And I would like to quote Rukia to give an impression of what she's facing in her children. For a long time, we faced many tough times. Droughts have often left us without enough water or food for our animals. Because of this, many of our animals on which we rely have died. I faced significant challenges in providing my children with sufficient food. There were instances when they attended school on an empty stomach because I couldn't afford to provide 3 meals a day. At times, they only had 1 meal a day. And I would like to say that this situation is affecting her children gravely. They are much more vulnerable to the health-related risks of the climate crisis, and this has led her family and children being forced to relocate in the country. But as you can imagine, Rukia isn't alone. From 2018 to 2024, 43 million children worldwide were displaced due to climate-related disasters such as droughts, floods, cyclones, really destroying agricultural lands, crops, healthcare facilities, infrastructure, and really putting children, and especially displaced and migrant children, at risk. And they are much more vulnerable to the health-related risks of the climate crisis, such as the increased spread and transmission of vector and waterborne diseases like malaria, cholera, dengue. And they often suffer from malnutrition. They often live in overcrowded and unsanitary conditions in refugee camps, and they face the trauma of displacement. And on top of that, and we've already talked about that, they are often not integrated into national health systems, which denies them the access to essential and life-saving health service they need. And I can see, you can not only see that in Ethiopia, you can see it across the entire Horn of Africa. Only in 2024, over 600,000 children were displaced, were affected by floods, really leading to the losses of their homes, but also leading to spikes in diseases like cholera. So what is Save the Children doing to respond to these crises? For instance, in Ethiopia, we're delivering essential health and nutrition services. We provide for psychosocial support. But also, when you look at the most recent floodings in Western and Central Africa, the recurring floodings, we are responding and we're providing for emergency relief via disseminating water, sanitation, and hygiene kits, but also cash assistance. And this is really vital for affected communities and children. And I would like to really address governments, parliamentarians, WHO, other CSO stakeholders, but also youth, to really act collectively to protect displaced and migrant children's health amidst the climate crisis. And I would like to really highlight 3 key actions that I think are key in doing so. First of all, really acknowledge, but then also take action on the disproportionate impact of the climate crisis on displaced and migrant children's health, while really listening to children's voices and needs, and obviously also youth. And this means to really meaningfully include children's voices and needs in climate health decision-making processes. But it also could mean mainstreaming children's voices and needs through negotiating tracks at the upcoming COP29. Secondly, I would like to highlight, and I've hinted to that, the urgent need to really include displaced and migrant children into national health systems, because that's the only way they can actually access the essential health services they need, which is why we very much welcomed the commitments done by governments at the Global Refugee Forum in 2023 to do exactly that. And I would like to urge WHO to really keep pushing those governments now to actually implement those pledges in the future. And thirdly, I would like to highlight the need for child-responsive policies and laws, really targeting the needs of displaced and migrant children, as well as adequate, predictable, and sustainable financing to actually respond to humanitarian crises, but also on the mid to long term, strengthen national health systems to allow for all children to access their right to health, no matter their migration status. So let me end with a call for action. I think I've made it clear this needs to be a collective multi-sectoral response that's needed to protect displaced and migrant children's health amidst the climate crisis. You've heard the story of Rukia. If we don't want to hear many more of those stories, I think it is key really to step up now and take action to really ensure all children can survive, thrive, and reach their full potential in an increasingly challenging world. Thank you.
Thank you, Marionka, also for suggesting very concrete actions. This is actually one of the aims of this session, is to try to find concrete solutions. Now the floor goes to Petra, please, and she will mention some also enhanced local action that we would like to focus on.
Thank you. Good morning. Maybe before I start, I would like to do an exercise. Raise your hand if you're currently not living in your country of origin.
Ooh, there you go.
Raise your hand if, no, keep your hands up. So others, raise your hand if any time in your life you moved and lived in a place other than your country of origin. Raise your hand if you know of a sister, brother, father, mother that have moved and located to another country other than country of origin. Raise your hand if you know of a friend, a cousin, keep your hands up, that are not living in their country of origin. Okay. So this is the world today. This is what's happening today. We are the privileged migrants because we were able to go into places and integrate in these places and got the privilege. Today, what we have been hearing are the unprivileged migrants, that we all want them to move from being unprivileged to privileged. And that's what we need to do collectively. We need to think about those that did not get the level of privilege that we all got to where we are here. Which takes me to speak a bit about the Red Cross Red Crescent. The Red Cross Red Crescent network is present in 191 countries. We have more than 200,000 branches. Most of those branches are in locations, rural places, suburbs where the national systems do not get to. But what's also unique about them is their ability to go into communities where the regular authorities are not able to go to, which are the underprivileged migrants and displaced. They have no trust in national systems in many locations. And this is where the Red Cross and Red Crescent comes in and plays that role. So because of this access, we hold the responsibility as a federation to support them to provide the best healthcare services possible, the basic one, and to bring dignified and respectful services to them. 4 things that we're currently doing. One is we mapped out all the healthcare system of the Red Cross Red Crescent. We have around 5,600 facilities globally. Many of those facilities are sitting in places of rural and underprivileged areas. Our aim is to render those facilities climate resilient. So we've launched a program to transform these facilities climate resilient. So that's one thing we're going to do. The other one is we're going to scale up our mobile health clinics. These areas are reached by mobile health clinics, whether in immunization programs or primary healthcare services, community-based. So scaling up these mobile health clinics. The second effort that we are currently working on is community mobilization. And when we speak about community mobilization, we're talking about early warning signs, early warning systems. Particularly when it comes to health, we're talking about climate health disease surveillance. And I'll just give an example in Indonesia. In the last 2 years, with the Indonesian Red Cross, we worked on this climate disease surveillance. And as with climate change, dengue, the traditional dengue season is shifting and changing. And we are constantly working with our volunteers to continue monitoring and surveilling outside the traditional season. And outside the traditional season, they've issued 184 alerts. 114 of those 184 were confirmed dengue cases outside the traditional season of dengue. So that's on the second one. The third one is related to those displaced. So while we're working in communities where the displaced, the host communities end up, but there is the route, the displacement route, and that's the most dangerous one. We have what we call the global route-based migration program that focuses on the migration routes on land and on sea. On the land, we have more than 600 humanitarian service points along the migration route. In these humanitarian service points, we provide basic medical care, but what's most important is we provide mental health and psychosocial support. The level of pressure and harassment and all sorts of things that the migrants face while going through this route requires tremendous support on mental health and psychosocial support. And then we have the sea. We partner with SOS Mediterranean. In the Mediterranean, we have the Ocean Viking that is supporting people migrating towards Europe. And since 2021, this SOS Mediterranean has saved 5,600 people. The program, this Global Route program, in 2023 reached more than 1.5 million people, migrants, on their route. The last point I'd like to raise sums up all 3 points. The reason we do it is because we're part of communities and we understand. And community engagement is key. The Honorable Parliamentary mentioned bringing voices. The communities know what's happening in their communities. No one wants to leave home. We need to co-create solutions to keep people in their homes and support them. Climate change is affecting these communities and it's forcing them to leave. If you ask people that are on the move, would you rather go through all of this or stay home? They're gonna say we wanna stay home. Yeah. Bring us back home. This is where we need to go. The root cause, the grassroots of the issues, we need to tackle them and support them where they are. Thank you.
Thank you, Petra. Very interesting. And now the floor goes to Stephen, who will address some multi-factor issues.
Good morning, everybody. I want to talk this morning about the need to embrace complexity and how we might go about doing that. Climate change, migration and health are individually very complex systems, and consequently, as we've been hearing from all the previous speakers, the intersection of these three, the nexus between them, is also extremely complex. Each system is subject to a multitude of polydirectional connections and channels of influence, and we do need to understand these if we're going to be able to undertake interventions that, first of all, actually work, and second, don't produce unintended consequences. It's evident, therefore, that we need to apply systems thinking in trying to make sense, not only of the individual systems, but also of the nexus formed between these three systems when they intersect. Systems thinking is important in the present context because it takes us away from linear cause and effect models of behaviour, which may seem to offer solutions that are tempting because of their simplicity, but they often fail. Instead, systems thinking guides us, for example, to recognise that it's meaningless to study single elements of a system without considering the interlinkages and the overall function that the system produces. So in examining and discussing migration and health over several years, we found it useful to adopt a broad and multidimensional framework that brings together a wide range of factors that are involved in these inter- and intra-system linkages. One of these framework dimensions involves looking at the situation of migrants in different settings from the perspective of structural factors. Deficits that affect the health of migrants and refugees have been observed in many structural factors, including rights, governance, policies, practices, equity, and social justice in states and systems. For example, migrants and refugees are often exceptionalized by governments, despite, as we've heard this morning, commitments to rights for all and to leaving no one behind. The concept of structural vulnerability has been offered in relation to the challenges, for example, of clinical care and healthcare advocacy for migrants, and this concept has aided consideration of how specific social, economic and political hierarchies and policies produce and pattern poor health. And in another aspect of this work, the absence of migrants from many national health systems in their statistics, and the absence of discussion of specific features of migrant health and what is required in the routine education and training of all health workers are examples of structural deficits. The second dimension involves something else that was mentioned this morning, that is health determinants. The Dahlgren-Whitehead rainbow model of health determinants incorporates a range of factors that are contained in categories or pillars of nutrition, lifestyle, environment, genetics, and medical care. And further extension of this model has come from understanding the importance of individual experience of events as a contributory factor to good or ill health. In this context, migration itself is recognized as a determinant of health, with contributory factors coming, again, as we've heard this morning, from individuals' experiences before, during, and after the migration process. As an example, restrictive entry and integration policies are linked to poor migrant health outcomes in many high-income countries and point to the need for a health in all policies perspective. Another type of determinant that's been recognised relatively recently is the opportunity of digital solutions to migrant and refugee health. And it's often put forward that these are able to bypass some of the barriers and roadblocks and to bring people who are otherwise very vulnerable and disadvantaged into better contact with health services and systems. We have recently been looking at this issue, and while it's true that there are many opportunities, we also recognise there are many risks. And some of these come from what one might call the dual use aspect of modern IT systems, and especially with the increasing incorporation of artificial intelligence, the opportunity on the one hand to make connections between migrants and services, and on the other to use those same channels to locate migrants, to identify who they are and what they are in terms of their backgrounds, documentation, and so on, which poses considerable risks to the well-being of the migrants and also raises their levels of anxiety with consequent mental health issues. A third dimension involves factors that are derived from the perspective of the human security framework, which the Honourable Minister, Member of Parliament rather, referred to earlier. The historic focus on physical security was expanded by the Human Development Report in 1994 through the concept of human security. The report redefined human security as being concerned with people rather than territory, and the concept has been expressed as freedom from want and fear and freedom to live in dignity. The concept incorporates threats to security in the areas of health, food, environmental, economic, personal, community and political domains, and we've heard examples of each of those domains in connection with migrant health and climate change this morning. So we think that the combination of a systems thinking tool and a framework that includes these three areas of structural factors, human security and determinants provides a useful starting point. It helps us to identify the channels through which things can go right or perhaps can go wrong, but it also helps us to try to devise solutions that are going to be effective without causing unintended harm. Thank you.
Thank you very much, Stephen. Really thanks to all for the very interesting interventions. We have time for a second round. Let's try to focus really on solutions, on concrete actions. Some of them were already mentioned. Maybe, Santino, shall we start with you to react also to what Marionka was proposing in terms of protection of children and concrete actions for them?
Of course, the protection of children, it's a condition which doesn't have any doubt that is a priority and needed. The reality is that we are engaged into a process, and I like to underline the word process, which is promising but still require collective effort and continuous engagement in order to change the situation. I like always to remember to colleagues and friends when I'm talking about the work we are doing that with WHO we started to deal with the public health aspect of population movement in a systematic manner in 2011. My personal interaction with the Ministry of Health of the country we were working with was, this is not an health issue. You should reach out to the Ministry of Interior, Ministry of Labor, Ministry of Foreign Affairs. So this showed clearly that there is a gap of understanding, and not only outside with the country, but also with us. If you think about that WHO waited until 2011 to have a kind of important engagement, systematic engagement of this topic, means that we were lacking clarity that this is not a side effect of the migratory process. So it's not something we need to intervene only when we see an outbreak, but it's important, and before was mentioned, COVID gave us a very powerful slap on the face, reminding to all of us that health is a founding element of human health and well-being. So when we are designing migratory policies to manage migration, to manage children, unaccompanied children, or irregular migrants, a detention-based type of approach, we need to understand that there is a fallout on the health sector. And we need to have and a system which is able to capture those needs which might arise because of the policy that the country is choosing to manage the migration. But also another reality that we are, allow me to be a bit provocative, we are using an ostrich type of approach. We like not to see that we are in a changing world. When I was at the primary school, my schoolmates were all from the same village. I knew the parents, the grandparents, everybody. Now, my grandchildren at the primary school, they're having 50%, maybe more, of the schoolmates that they are from other countries. So there is a change of the demography that we cannot continue to think about like nothing has been changed so far. So sorry for this broader picture, but I wanted to show what are the root causes of, or what is impacting on limiting the access and the action in support of groups which are the most vulnerable. Thank you.
Thank you, Santino. Other reactions, not necessarily in the same order. If you would like to come in, meet the youth.
Okay. Yeah,
Jaber.
I can intervene. So, I'm sorry. So yeah, like I've heard like what have been mentioned, and generally like there are some very like emotional like stories, and it is sad that we still hear those stories again and again, and like unfortunately from the same regions that are mostly the most affected. I just want to like maybe like give like more actionable actions to like how we can actually contribute. Just yesterday I've attended a meeting, and we were focusing a lot about the need of funding, and without funding we can't do anything, which is not the case. There is a lot of things we can, I mean, funding is important, but there are lots of things we can do without funding. And in most cases, in most regions, funding is not really there, but there are a lot of other things. In most countries, there are youth. You know, I showed the sticker here showing like 1.8 for change. 1.8 is like 1.8 billion youth. Like this is the number of youth we have. And it's a big number, you know, and we need to use them, you know, to a good use. As I said, we are innovative, we have great ideas, we are eager to work, but I do believe that these numbers can actually work on prevention, on reaching out to the communities, working on education, educating the communities about the good practices, how to prevent those, you know, like displacement, and then those communities can also share those information with their like peers to prevent those kind of displacement. It's also good education, and like science is also very important. It's good to educate, you know, people and to know if any major climate events might happen in certain regions and prevent those catastrophes and disasters from happening. If you know that this region, this village is going to be flooded, better evacuate way before then the flood is happening, just to save lives. But one of the other points that, and we're going to focus on this as civil society during COP29, like in 4 weeks, is health systems preparedness. We need more resilient health systems. A lot of health systems, yes, focus on the health aspects, focus on other issues, but don't really focus on climate events and like the effect of climate change. So we really need to talk about that as well and try to convince governments to really focus on also preparing their health systems to be more climate resilient. I think that's it. Thank you.
Thank you, Jaber. Other reactions from the panel, please, Honorable Saber.
Thank you for giving me the floor again. Precisely tapping on some points, I think innovative policy solutions, including the Nexus approach, is extremely important. Any policymaker should be thinking comprehensively other than just putting the effort into his or her file. This is one of the points. Other one is, as I have been hearing from others, youth is, especially Gaber, a very important factor in this equation. So lots of awareness campaigns, engaging them in the policy-making decision, and also the role of the civil society. Civil society is a kind of a real trigger that is still not functioning as it should. I started an NGO in Egypt which just aims to connect policymakers along with civil society and academia, because also the science and the numbers and the findings and the research, the billions that are spent there, are very important to reach the decision maker as well. So linking the dots is extremely important. One other thing is actually de-escalating the conflict. We should do something, because conflict zones and war are one of the main reasons why people migrate and displace. This is important. We should do whatever is needed, every and each one of us, to highlight the criminal wars, to apply the international law, and to stop the wars with whatever tools we have in our hands. Budgeting for health also, it should really increase. Imagine the billions of dollars that are spent now towards arming and towards war. If this is spent on health and education, how our world would be in meeting the 2030 goals and the SDGs. Technology also is key. And last but not least, mental health. Mental health is important. We should think of how to include it, and to include psychic health within the umbrella of medical insurance as well, and definitely reducing inequalities along with the role of arts, music and movies, which I think is extremely important in bringing peace and in enforcing inclusion. Thank you.
Thank you. Thank you.
Yeah. So,
Please, Nicola.
yeah, I think addressing the issue of the health of migrants, including the mental health of migrants, we will ultimately have to start thinking about what it is to be human. A lot of our policies, a lot of our legislation, a lot of our thinking doesn't take into consideration what it is to be human. We think about ourselves as subsets of human. And if we all agree that all human lives are worth saving, so to speak to the point that the Member of Parliament has raised, if we all agree that all human lives are worth saving, then we would be able to set up systems and structures that will take care of everyone, including migrants in the spaces that they find themselves in, and including reducing the need for migration. I think, so dealing with migration and health requires a fundamental rethink of what it is to be human. Actions in the high-income countries have led to a lot of the crises in the low and middle-income countries that we are seeing today. And if we think about what it is to be human, then it will be necessary for those that are in power in the high-income countries to start thinking about solutions that will support the people in their countries, but also in the countries where they have caused a lot of harm. I think if that is done, it will reduce the need for migration, and it will reduce the need for dealing with migrants in the high-income countries, because then people in the low and middle-income countries will not have to move. So a more global mindset, a more human-centered mindset in policy making, in legislation, in structuring things will reduce migration and will improve lives for everyone. What I see today is in all countries, including low and middle income countries, there's a lot of seclusionist thinking. There's a lot of planning and structuring that privileges certain groups of people and places people who are migrating at disadvantage and increases mental health negative outcomes. But if we change that mindset, then we will not have to worry a lot about the anxieties that are caused among people who are migrating and increasing the need for migration. So I think WHO legislators, people who are in spaces where they can make laws, where they can make policies, they have to stop thinking about themselves as subsets of humans and start thinking about setting up structures that work for everyone, including people who are migrating for whatever reason. Thank you.
Thank you, Dr. The reactions are not necessarily in the same order, but maybe we are following.
Yes,
you.
we are.
This is a panel.
Very obedient at 10 o'clock. But yes, I would like to highlight maybe a three-pronged approach, or rather four-pronged approach, which is on systems, financing, participation, and accountability. So let me start with systems, and I think there's two levels to it, and we've already alluded to it. The systems thinking that you talked about, really to see that protecting children's and displaced and migrant children's health amidst the climate crisis doesn't just demand working with the ministries of health. It also asks, to work with the finance ministries, because maybe they are the power brokers in certain countries. So really go for a whole of government and multi-sectoral approach to protecting those children's right to health. Secondly, and that's the second level to systems, is really thinking about how can we, and you alluded to that, how can we create climate resilient health systems? How can we make communities and children, especially displaced and migrant children, resilient against the effects of the climate crisis? So that's on systems. Then on financing, I've already mentioned the need to really ensure there is both the humanitarian response on the short term, but also the mid to long term response by strengthening national health systems. I think you, Dr. Severoni, already talked about that. And I think that's key to remember, especially in times of a tightening fiscal space, as we can see it, both by donor governments, but also, at the national level. And thirdly, I would like to flag again, I think I'm just repeating what you said, Jaber, the importance of really including children's voices and needs, because how can we develop and implement child-responsive policies that actually address those needs? We really need to listen, plus also need to address their needs, not just ensure for a tick box exercise, but really also show how policymakers have addressed voices and needs of those children, and that calls for accountability. And I think that's a missing cycle that we repeatedly face in politics or in policy making. We do a policy, but then we don't follow up. There's no accountability, and there's no collective pressure on policymakers to actually implement those policies and showcase how they've really reached displaced and migrant children and protect their health. Thank you.
Perfect. Thank you, Maria. So now, Petra, we follow the order now.
Well, okay. Well, I mean, I think we don't lack ideas and solutions. This session has demonstrated that we know what needs to be done. The question is, who's lacking in this room that needs to do it? And we keep, Santino and myself, we've been to many of those sessions, and we've met many decision makers. The question is, what else needs to be done so that all of this information, all those great ideas get done? The late Paul Farmer once said, if health is a human right, like it is, who is human enough to get this right? Are the migrants human enough to get this right? This is a question that we always constantly are wondering and pondering about. We need to get to those that are not listening today. Who are they? We need to identify them. And many of them are at home. Many of them are in our communities. It's not just the politicians and the policymakers. It's also, some of it is stemming from insecurity, fears. This is the reality of the world we live in today. There's a lot of fear circulating. There's a lot of insecurity going around. The question remains, who do we need to get to make this happen? I don't have the answer. I think we all need to come up with some sort of, maybe an NGO that can give us an answer to that. Help guide us, humanitarians. Who else we need to talk to shake the tree well enough to get actions done, and not just piecemeal. We have things going on. I mean, I have lots of figures. All of us are doing good work and saving lives, but we're not fixing the root cause of all of this. The numbers keep increasing. So something else needs to be done. Thank you.
Thank you.
I'd like to pick up on the point of change, which many people refer to, and noting how things have been changing over recent times. And I think that is a very central attribute that we need to consider much more carefully and more explicitly. Since around the middle of the 20th century, everything has been accelerating. In fact, this period has become known as the Great Acceleration. And whether you look at socio-economic indicators of what we do as human beings, or whether you look at measures of the physical and biological environments around us, the numbers are all changing with increasing rapidity. Our levels of activity in every way are going up, and the quality of our environment in just about every way is going down. And that great acceleration led the 20th century sociologist and philosopher Zygmunt Bauman around the year 2000 to write about the fact that we live in what he called liquid times. The world is changing so rapidly, he said, that our institutions are no longer able to change and be built, new ones be built fast enough to cope with these changes. They're already out of date by the time we've tried to fix them. And even the pathways, the mechanisms that we've grown used to as ways of handling change have become unreliable, and we can no longer depend on them to fix things in time. And against that background, this increasing problem that we're now seeing of increasing migration due to climate change, which of course is one of those indicators itself of the great acceleration, those connections are becoming harder and harder to deal with. And that temporal aspect also is one of the things that we appreciate when we look at systems. Systems have a temporal aspect, and we need to be aware of different time frames in which things take place. And governments and international institutions have certain cycles and time frames within which rules, regulations, policies, and interventions can be changed, and they're often too slow at the moment for dealing with the issues that we have. Other sorts of institutions, and especially more grassroots and independent ones, NGOs, community groups, individuals, associations, have the capacity to change much more rapidly. Now, I'm not saying that we should abandon the formal institutions of governments and international agencies, but rather recognise that they can at best only be part of the solution. And what we need is a multi-track approach which involves all of these other groups, as far as possible working together, but encouraging each other to move forward, because it's that kind of innovation that will potentially bring the problems to a solution.
Thank you, Stephen. Maybe Santino, very briefly, before opening the floor.
Yeah, just a quick reaction to Petra, my friend Petra and Martin. I think that's the center of the discussion. What can be done? In reality, we do know very well what needs to be done. In relation to the world which is changing, we need to keep sharing and informing what are the changes. Today, probably 40%, actually even more, of the country worldwide, they are modifying their own national policies in order to include refugees and migrants. As we speak, Kenya, Uganda, they are extending the health insurance coverage to refugees, being big hubs for refugees, and they're revising their financing mechanism, despite the shortage of national domestic resources. So there is a change in the world that we need to keep walking the talk and working with the countries almost in one-to-one. In terms of actions, we need to keep investing on research. Martin spelled out very well that it's really complex, the interconnection of the three topics, migration, climate changes, and health, and we do know very little. So we need to keep investing into research in order to have strong evidence. We need better data. Imagine that today we don't have a mapping of the geographic area which are fragile in terms of triggering community migration because of climate change. We don't know. We just discover once it happened. So we really cannot anticipate interventions. And the last point is inter-country collaboration. We need to understand that communities, especially in the rural area, they are migrating since centuries because the climate changes are recurrent phenomenon. So if we look at the northern Kenya, Somalia, people have been moving across the border for a number of years. So there is, first of all, a treasure of experience in the community, and we need to involve those communities into the research in order to learn how they mitigated, how they adapted to the situation. But then we need to also experiment inter-country, cross-border type of provision of services and human resources for health. The health system today is designed to serve only the country within the border, so lack the flexibility to follow the problem. It's following the people within a certain context. So we are not able to share resources across the border and to, for example, have a mechanism of revolving fund for whom migrants which are migrating because of climate changes, they can go to healthcare services, primary healthcare service across the border regardless their nationality. We don't have those experiences, so we need to start to experiment this kind of collaboration and sharing of the resources, especially because we are constantly confronting with a shortage of financial means. So it's very important that we are utilizing this at the best. Thank you.
Thank you, Santino. As you know, this is a very complicated topic, and we try to include in the panel different voices from different organizations, but we could not include IOM, and so, but we have IOM in the first row, so.
Thanks, Luciano. Thank you so much. And I'd like to applaud you.
Introduce yourself
Okay, so my name is Dr. Colwick
Stand up.
Ramage. Hello, everyone. Colwick Ramage, the UN Migration Agency, IOM, head of health research and epidemiology. I'd like to thank Luciano for actually what you said, for keeping the flame of migrant and refugee health alive within this ecosystem, so bravo. I would like to thank the panel for the wonderful interventions. We are here, what I love about the WHS is that unlike, say, the World Health Assembly, we are a bit more relaxed. We can find a bit more less normative debate. So here is to be provocative, as Santino said, with IOM. Okay, so it's about safe, orderly labor migration, ensuring regular pathways. But one of the things that I wanted to pick up for some of the speakers is who are the stakeholders not in the room today to find those solutions? And I'm going to actually add a level of complexity now of climate change, migration, health, and antimicrobial resistance. And that is, and hear me out here, when we look at intensive factory farms in the world today, if you look at animal husbandry, if you look at meat and poultry producing sector, this sector is overrepresented by low-skilled, low-waged, precarious labor migrant workers, often undocumented workers. From the farms of Western Sydney to the Mekong region, where you have these intensive zones of factory producing, you find these undocumented migrant workers. And this is a critical nexus between zoonosis, uses of antimicrobial, antibiotic use, and yet they are silent within disease surveillance systems, around data collection. There's no disaggregation around what is really happening with these health of low-skilled, low-wage migrant workers in these factory farm settings. This is an industrial complex, and the stakeholder in the room that is not here is around the big industrial sectors, for example, animal husbandry, etc. I think it's really important when we push for solutions in this space, and we heard intersectoral action. We really need the corporate sector. We really need these sectors to come on board. It's not just government, it's not just academe. And I feel like a clarion call is that this stakeholder needs to be meaningfully engaged, because the solutions can also be found with occupational health and safety, ensuring health coverage, healthcare financing of this sector. Thank you.
Thank you very much. So we have time for a couple of questions, because at the end we have also two important answers that we have to make. It's difficult to, let me see, gender balance first of all, so we have to pick up one man and one woman. Maybe I see one here and then a woman there in the middle. So please introduce yourself. Yeah, sorry, we cannot take all the questions, but there will be time also during the coffee break for discussion.
Okay, so good morning, everyone, and interesting.
Stand up.
Okay.
Just that people will see you. Yeah.
Good morning, everyone, and interesting conversations. My name is Odinaka Kingsley Obeta, and I'm a co-chair of the RBM Partnership Youth Workstream. I want to just say very kudos to the entire speakers, but then want to just point a few things out that I think is very, very critical. Over the past years, one of the major issues we've had, even when it comes to discussions like this, is the concept of collaboration, which I think Santino had rightly mentioned. And as young people, one of the key things that we are trying to fix at this point is trying to ensure that we have unified voices. Jabba already mentioned why it is important to include young people in discussions like this, and also why it is important to create systems where young people can really function and make contributions. We already at this level are collaborating. There are various youth initiatives across the world. We had a youth summit just a day before the commencement of the WHS, and international youth initiatives met here in Berlin. We had conversations on how we can unify our activities and ensure that we have a coordinated response when it comes to some of these issues that we're talking about. So I just want to ask all of our panelists, and especially even Santino from WHO perspective, what exactly are the structures currently available for engaging young people, when it comes to response around climate change, health, and migration? And because we have had a lot of conversations, but we're talking about actions. as we leave here, we need to know what are the commitments that each of the agencies and each of the representatives, even the parliamentarians, are going to be doing after here in this regard. Thank you so much.
Thank you.
From my experience and knowledge, so let's also consider the opportunity. I'm not totally updated. There is a lot of attention on youth, but in terms of formal structure to make them to contribute, I don't see many. That's the reality. Even regular hearing from the parliamentarian commissions or mechanisms to contribute to policy formulation processes, I don't see much. So it's really very much advocated and mentioned by politicians when we want to expand the reach out of the audience. But I repeat, I might be not updated, but that's my feeling. Thank you.
Thank you, Santino. So the last question, then we have... Yeah, please. Very quick, please introduce yourself.
I'm Holly Campbell-Rosen. I'm from the National Institute of Mental Health at NIH in the States, and I oversee a program on migration and mental health. Dr. Severoni brought up the issue of inter-country collaboration, and I wanted to ask you, as well as the Honorable Member of Parliament, to what degree would it be feasible for different governments to work on policies that impact migrants' ability to have, I'm losing the word, their medical records and the continuity of care across countries, because we know a lot of them are transiting through countries that they're not ultimately going to reside in. And so that complexity is something that I wanted to ask you about, whether or not you've thought about it, perhaps how difficult it is to work on. Thank you.
Thank you. Very quickly. Maybe Santino again. And
Maybe
Amira, yeah.
she can start.
Yeah,
I've
okay.
been speaking too much.
Your question is very, very important because personally I have friends who have suffered somehow from that. But recently I got to know that some private sector companies in some sectors very specific, I'm not just mentioning the mental health, but in some sectors like radiology and other sectors, they have applications where actually this is possible, where all the data of the patients could be uploaded and the system is authorized to have the doctors from across the countries who are overseeing the case having the data of the patients available to them. So we can really think of, and I'm also linking this to what has been said in this room from the gentleman about the crucial role of the private sector. Sometimes governments and policymakers are kind of lagging to introduce solutions, but the pace of the private sector is somehow faster. So this started, but what I really highlight here that I myself should take this back home and ask for an oversight tool on how to make this also from the government side and from the policymaker side. Thank you.
Thank you very much.
A short answer, we are not yet where we should be. Yeah. Again, we know very well what should be done, but it's not there. And mostly the reason is political. The focus of the country's engagement on this topic is on border management rather than inter-country collaboration. And there is a misuse of the information related to migration, which happened just recently, which is regularly utilized by politicians in order to generate consensus. You are from US, I understood. I encourage you to look on internet and search on the last speech to the nation of Ronald Reagan, a very strong conservative. This was 40 years ago. And listen to the last speech to the nation, which was on migration, how the political language shifts from there today. The speech of Ronald Reagan 40 years ago could be compared today with the speech of the Secretary General of the United Nations, just to give an idea. So this is the main obstacle to inter-country collaboration. But there is a technicality. Still, many countries are using data, regardless if are health data, for migration management. So the protection of data, the utilization of data only for medical purpose is paramount. And still we are not there in protecting those informations. Thank you.
Can I just
Yes, thank you, Santino. Petra, very quickly, we need to close.
I think when it comes to cross-border health, we do have successful models when politicians want. I'll give an example on nomads in Africa and immunization. We carry over immunization program for the nomads as they move across in Africa between the Red Cross. So every Red Cross where they end up transfers their immunization schedule to the next Red Cross, and it's working perfectly fine. Because politicians are okay with nomads moving and letting us do our job in immunizing them. That's not the case when it comes to when they're not okay. Going back to Santino's point, we do not lack solutions. That's the point. We have solutions. We need the people that are not in the room to be in the room to let us do the solutions.
Yeah. Yes, thank you. It's a pity that we don't have enough time for this discussion, but again, during the coffee break, you can approach the speakers. Now I would like to introduce a very good initiative by WHO. Is a global school on refugee and migrant health. Maybe, Santino, if you just want to say a few words before we screen the video, or we just screen the video first.
Thank you, Luciano and WHS, to give us this 1 minute space. Basically, this initiative started a few years ago and becoming a flagship. We see a growing interest. Every year we are offering opportunity for policymakers, government representatives, academia, students, international organizations representatives to meet the leading experts worldwide and focus on a certain region. This year we're going to go to Colombia. We're talking about how expanding the health insurance coverage, the universal health insurance to the entire population. Colombia is doing with 1.4 million of people, so it's a major health financing reform. But also what we discover is that Colombia, through the expansion of the health insurance to the refugees, understood that the system that in place for the national is not functioning, so they are reforming the entire system, utilizing the experience with refugees. This year is going to be a collaboration with PAO, so we will have also other experience from around the world with the Pan American Health Organization, the collaboration. And you're most welcome. It's an hybrid event. You don't need to travel to Colombia. You can just sit at home in your couch and watch the school and the informations and material which we're going to display. All of them original, means casted, developed exactly for the week of exercise we're going to have at the beginning of December. Thank you.
Thank you. And we will screen the video now.
Please. There are flyers at the end of the room.
There are some flyers, yes, at the end.
When people move from their homes and countries, they may face many challenges. Addressing the health needs and rights of refugees and migrants and providing people-centered care requires understanding of their cultural, language and gender-specific needs that have a bearing on physical and mental health and overall well-being. WHO's Department of Health and Migration is supporting countries to address health needs and rights for people on the move through its Global School on Refugee and Migrant Health. This flagship 5-day course is hosted in different WHO regions each year and focuses on a theme informed by the needs of the host region. It is an opportunity for governments, UN agencies, researchers, NGOs, and civil society, including migrants and refugees, to come together to share country experience and knowledge, outline good practices, identify gaps, and collectively pave the way ahead, leaving no one behind. From 2020 to 2023, global schools were held in Switzerland, Jordan, Bangladesh, and Senegal, with Colombia hosting the 2024 school, attended online and in person.
Thank you. Thank you for this. Thank you for this excellent initiative. You can easily find the website if you Google main words, and also in the back of the room there are some flyers that you can take. Now, finally, I would like to use the final 2 minutes for an important announcement, because we are launching a commission of the Lancet Regional Health Europe, and I would like to thank the chief editor Pooja Jha, who is also in the room, in close collaboration with WHS Academic Alliance. And I would like to give the floor to Professor Stephen Matlin, that is co-chairing this commission with me, to just describe in 2 minutes, Stephen, this important initiative.
Thank you, Luciano. And as you just said, we're delighted to announce this new venture, the WHS Academic Alliance and the Lancet Regional Health Europe, forming a commission on health, migration and climate change in the European context. Luciano and I are going to be co-chairing this commission, which is launched now, and will involve the work of about 30 commissioners, which is going to be conducted through 4 working groups in the first instance. Working Group 1 is focused on the global context of health, migration and climate change, and is being led by WHO. Working Group 2 is concerned with the impact of climate change on patterns of migration in and within Europe. And the third and fourth working groups will look at the health of migrants from 2 complementary perspectives. Working Group 3 will look at the impacts of climate change on the health needs of migrants in Europe, while Working Group 4 will look at European responses and will be taking a broad social determinants of health approach. So the Commission begins its work this week. We'll normally be working entirely through teleconferences and offline, but we're taking advantage of the presence of a number of the commissioners here in Berlin at the WHS to meet in person tomorrow. Thank you.
Perfect. Thank you, Stephen. And so at this point we need to close the session. As Italian in Germany, I'm a bit stressed about time, so we need to on time. Let me thank very much the panel. Thank you very much for the very interesting. Thank you to all of you for participating this morning. And again, stay tuned, because we will organize other sessions in the near future. Thanks.